Hi everyone, I'm Jishida from First MSc Biology, St. Mary's College, Thrissur. Today I'm going to deal with the topic cytokines related diseases. First of all, what is cytokines? Cytokines are small non-structural protein with low molecular weight which have a complex regulatory influence or inflammation and immunity. Cytokines are pleiotropic protein or small glycoprotein with a molecular weight less than 30 kDa secreted by white blood cells and various other cells in the body. Development of an effective immune response involves lymphoid cell, inflammatory cells, and hematopoietic cells. The complex interaction among these cells are mediated by a group of protein collectively called cytokines. Cytokine-related diseases. Defects in the complex regulatory networks governing the expression of cytokine and cytokine receptors have been implicated in a number of diseases. Here, explain several diseases resulting from overexpression or underexpression of cytokine and cytokine receptors. First one, Chagas disease. Second one, bacterial septic shock disease. Third one, lymphoid and myeloid cancer. Let's discuss Chagas disease. It is caused by a parasite called Trypanosoma cruzi. It is an infectious disease caused by a parasite found in the feces of tritomine bug. Symptoms: pain in abdomen or muscles, whole body fever or body ache, headache, painless swelling around eye, palpitation or skin rashes. Figure showing the symptoms of Chagas disease. Trypanosoma cruzi is a causative agent of Chagas disease which is characterized by severe immune suppression. The ability of Trypanosoma cruzi to mediate immune suppression can be observed by culturing peripheral blood T cells in the presence and absence of Trypanosoma cruzi and then evaluating their immune reactivity. Antigen, mitogen, or anti-CDP monoclonal antibodies normally activate peripheral T cells, but in the presence of Trypanosoma cruzi, T cells are not activated by these agents. The defects in these lymphocytes leads to reduction in the expression of 55 kDa alpha subunit of IL-2 receptor. What is IL-2 receptor? The interleukin 2 receptor is a heterotrimetric protein expressed on the surface of certain immune cells such as lymphocytes that bind and respond to a cytokine called interleukin 2. Structure: three distinct subunits: the alpha chain, the beta chain, and the gamma chain. The alpha subunits specific for cytokine binding, seroculturing of T cells with Trypanosoma cruzi and subsequent staining with fluorescence in a labeled anti-tag which binds to the alpha subunits, resulting in 90% decrease in the level of alpha subunit. The mechanism by which Trypanosoma cruzi suppresses the expression of the alpha subunit is still unknown. The expression can be induced across a filter that prevents contact between lymphocytes and protozoa. The findings suggest that a diffusible factor mediates suppression. Such a factor, once isolated, it may have numerous clinical applications for regulating the level of activated T cells in leukemias and autoimmune disease. Prevention. Avoid sleeping in a mud, thatch, or adobe house. These types of residences are more likely to harbor triatomine bugs. Use insecticide soaked netting over your bed when sleeping in thatch, mud, or adobe houses. Use insecticides to remove insects from your residence. Use insect repellent on exposed skin. Next disease is the bacterial septic shock. What is septic shock? Septic shock is a life-threatening condition that happens when your blood pressure drops to a dangerously low level after an infection. Any type of bacteria can cause the infection. Fungi such as candida and viruses can also be a cause, although this is rare. At first, the infection can lead to a reaction called sepsis. Septic shock is a severe complication of sepsis and can alter mental state and organ dysfunction. This affects your heart's ability to pump blood to your organs, which lowers your blood pressure and means blood does not reach vital organs such as brain and liver. Symptoms: drop in blood pressure, fever, diarrhea, widespread blood clotting in various organs, a change in your mental state, such as confusion or disorientation, nausea and vomiting, cold, clammy and pale skin. Septic shock results when the infectious microorganisms in the bloodstream induce a profound inflammatory response, causing hemodynamic decompensation. This condition may develop a few hours after infection by certain gram-negative bacteria, Pseudomonas aerogens, and Neisseria meningitidis. Role of cytokine overproduction in pathogenesis can be illustrated by bacterial septic shock. This condition caused in 5 lakh Americans annually and causes more than 70,000 deaths. Bacterial septic shock apparently develops because bacterial cell wall endotoxin stimulates macrophages to overproduce interleukin 1 and tumor necrosis factor alpha to levels that cause septic shock. There are many studies to explain this. Higher levels of TNF alpha were found in patients who died of meningitis than in those who recovered. Furthermore, a condition resembling bacteria septic shock can be produced by injecting mice with a recombinant TNF alpha in the absence of gram negative bacterial infection. In one study, TNF alpha or interleukin 1 activity with monoclonal antibodies or antagonists may prevent this fatal shock from developing in this bacterial infection. In one study, monoclonal antibody to TNF alpha protected animals from endotoxin induced shock. Another study showed injection of recombinant interleukin 1 receptor antagonist, which prevents binding of interleukin 1 to the interleukin 1 receptor, resulted in a threefold reduction in mortality. It is hoped that these experiments results will lead to clinically useful products for the treatment of bacterial septic shock in humans. Prevention. Get regular vaccinations against viral infection that may cause sepsis. Practice good hygiene. Care for and clean any open or gaping wounds. Follow medical advice on managing bacterial infections. Treat fungal and parasitic infections as soon as symptoms appear. Control diabetics if relevant. Avoid smoking. Last topic is the cytokine activity is implicated in lymphoid and myeloid cancers. Abnormalities in the production of cytokines or their receptors have been associated with some types of cancer. For example, abnormally high levels of interleukin 6 are secreted by cardiac myxoma cells, myeloma and plasmacytoma cells, and cervical and bladder cancer cells. In myeloma and plasmacytoma cells, interleukin 6 appears to operate in an autocrine manner to stimulate cell proliferation. When monoclonal antibodies to interleukin 6 are added to in vitro cultures of myeloma cells, their growth is inhibited. In contrast, transgenic mice that express high levels of interleukin 6 have been found to exhibit a massive fatal plasma cell proliferation called plasmacytosis. Although these plasma cells are not malignant, the high rate of plasma cell proliferation possibly contributes to the development of cancer. Thank you.